Good afternoon. My name is Leanna, and I will be your conference operator today. At this time, I would like to welcome everyone to the CHW State Network Strategic Planning How and Why conference call. All lines will remain on mute to prevent any background noise. Thank you. I will now turn the call over to our host, Anita O. You may begin your conference.
Thank you. Good afternoon, everyone, and welcome to our third webinar. My name is Anita, and I will be providing you with a few pointers to get you acquainted with this webinar technology. Please make sure to connect to our meeting room using the link provided in your confirmation email. Our panelist presentation will be displayed at the center of your screen. You may enter your questions anytime throughout the webinar using the chat box located on the left-hand side of your screen, right under the participant list. My text is in red as our dial-in information. Thank you. Enjoy this webinar, and I will now turn it over to Durrell.
Hello. Welcome, everyone. Thank you all so much for joining us today. Next slide. Today, I'm really here to welcome everyone to this call. I'm going to facilitate a panel discussion on the topic of CHW State Networks Strategic Planning, the how and the why. I will be asking 4 questions of each panelist, and they will go a rotating manner. Each will have an opportunity to address the question. There will be some brief time for question and answers after each question has been answered by the panelists. And we're asking members of this call, participants, to type your question in the chat box. At any moment while any of the panelists are speaking, you can type your question. We will not entertain questions until after those panelists have spoken. And due to time constraints, we will use a couple of questions from the list in the chat box. So I ask you to please bear with us on that. Our planning team will use a collaborative partnership approach to identify questions that best address comments from the panelists and best meet with the goal and purpose of this call, which is around CHW network development, strategic planning. We may only get to 1 or 2 questions during the call. However, we will follow up after the call with response addressed in the chat box during the call. We're not sure how long that process will be, so please know that all of the panelists have agreed to assist with this. Now I'd like to turn it over to Anita McDonald from Sanofi to briefly share why they're engaged in this effort with us. Thank you so much. Next slide.
Good afternoon, everyone. We're so happy to have you back with us. This is, as many of you know, our third webinar in this series. And I think it's important just for us to thank the leaders on the call and those who have put this series together. And some of them are on the call, Sergio Matos, Gail Hirsch, as well as Carl Rush, as well as you'll hear from all the panelists who have been involved with this specific call, Geoffrey Wilkinson and others. But I just wanted to share with you very briefly why Sanofi, a pharmaceutical company, is involved with the community health workers and this effort. And just who is Sanofi? First of all, we are a global healthcare company focused on patients' needs. We're engaged in research, development, manufacturing, and marketing of innovative therapeutic solutions. And you can see we have 7 growth platforms, areas that we are focused on. You might not know the name Sanofi, but you probably know some of the products, such as Lantus and Allegra and Plavix, and some of the vaccines that we have. So we are a global company, and we're very interested in the work of the community health workers, and I'll share with you the next slide, where you might wonder, based on our background and what we do, why are we interested? What your work really involves ties very closely with our mission in the Center for Chronic Disease Prevention and Health. And 3 of the big points around our mission, the pillars, preventing disease and supporting patients. Well, we think about when we engage the community health worker workforce through support of policy changes, secure funding mechanisms, and workforce development, that should lead to improving disease prevention and greater patient support, which ties perfectly with our mission. Also, improving access to health care, that's exactly what the community health workers do, linking the right patient with the right intervention at the right time. And traditionally, the community health worker has focused on the whole patient approach, and that's exactly what we're trying to do at Sanofi. And then lastly, exploring the boundaries of medical innovation we are supporting the community health worker workforce for prevention and new care models for chronic disease and prevention. Next slide, please. So some of the work that we've done to date, and I had the great opportunity of meeting many of you at the Unity Conference, but I wanted to just start, we are an international organization, and as such, we really appreciate the value of community health workers and advocate for the advancement of this workforce and profession by supporting and providing certain level of resources at meetings, et cetera. We're interested in developing solutions that could really leverage your high-quality asset to improve health care. As many of you know, we had an advisory board in November of 2014, and the intent was to get a better understanding of the impact of community health workers around disease prevention and access to health care. So we are interested in helping pave the way for the development of a national CHW organization, and that was one of the outputs and recommendations from the advisory board. We're also partnering with the National Health Plan to conduct research regarding the role of the community health worker in medication adherence so that multiple stakeholders are aware of the value that the community health worker work can bring. As I mentioned earlier, we were one of the sponsors of the Unity Conference. And lastly, we have an electronic portfolio that Anita O, who started the conference, compiled to support and strengthen the impact of the community health workers by looking at all the positive outcomes that your work has produced. So next slide, please. We're really happy to have you on the call, and I hope that short introduction helps you understand why we are helping and working and facilitating these conference calls. And I'd like to thank you for joining us to strengthen the CHW network to improve health. Next slide, please. I wanted to, before we move on, have an opportunity to introduce Durrell Fox, who you heard from already. Many of you already know Durrell, and we are thrilled to have Durrell be able to moderate this call. A short introduction, Durrell is a community health worker with over 25 years of experience providing HIV counseling, testing, support group facilitation, outreach to, advocacy, and case management for HIV-positive adolescents, young adults, their families, and communities. He is currently a CHW and health equity consultant and continues in his CHW role coordinating and staffing a young men's rites of passage program on Saturdays in Boston. Since 1991, Durrell has been involved in local, state, regional, and national CHW workforce development efforts, including serving as one of the founding members of the Massachusetts Association of CHWs, the CHW section of the American Public Health Association, the American Association of CHWs, the New England CHW Coalition, and New England Health Equity Council. He also serves as co-chair of the Readers Panel for the C3 Project and is a member of the advisory work group for the Massachusetts CHW Board of Certification. He's participated in strategic planning processes over the course of his work for the American Association of CHWs, for the Massachusetts Association of CHWs, for the American Public Health Association, and the Massachusetts Public Health Association. So it is a great pleasure to have Durrell take over and moderate the rest of this conference. Thank you so much, Durrell, for joining. Next slide, please.
Wow, that was way too much. But thank you, everyone, and thank you for those words, Anita. I want to just recap the goal of the webinar series, which is to develop, organize, and strengthen CHW state networks to advance the CHW workforce. The purpose of the webinar series, and this is part 3 of a 4-part series, is to pave the way for development of a national organization for the CHW profession through creation of a platform of support and education. And I really, you've heard from Anita some of my past involvement in this, and I think this webinar's focus on CHW Network Association strategic planning is critical. It's critical to how we develop strong, enduring CHW-led networks and associations that truly embrace CHW self-determination and progress and support the CHW workforce. Some of the observations that I and others who were planning this have made is how critical group dynamics and team development are while you're entering the strategic planning process, especially when entering discussions around mission and vision. And there's really always identifying an appropriate time and place for strategic planning, and we encourage folks to really do some connecting exercises and team building before starting or early on strategic planning process if you're really looking for optimal success. Those relationships and shared commitment and core values truly help as you delve into the nitty-gritty of strategic planning processes. The strategic plan should be a tool to help the group define your priorities and set a path to achieve them, so all of us who are part of the planning team feel this is a critical element to the CHW movement. Also, we've learned, some of us through our times with strategic planning processes with different organizations, that it also can help kind of refocus energies, reevaluate past goals and objectives, and can help mature groups as you are developing a sustainable program or project. Next slide, please. Now, without further ado, we get to the great part of the call, is where the panelists will begin to give us their thoughts on 4 questions on CHW network development. CHW State Network Strategic Planning, the how and why. First, I want to introduce you to Dana Ray Feist, who will be co-presenting with Ashley Winterstrom, who I will introduce in a few moments. Dana Feist serves as the Professional Development and Patient Care Coordinator for the Louisiana Cancer Prevention and Control Programs, which is housed at Louisiana State University School of Public Health. She has over 15 years of experience working with underserved populations in the areas of comprehensive cancer control, clinical trials, community outreach, coalition building, patient navigation, and I'll just add a ... to that. She is a board member of the Louisiana Community Health Outreach Network, also known as LaShawn. Next up is Paola Gutierrez, forgive me for the pronunciation, who is a native of Greensville, South Carolina, born to Colombian immigrant parents. Paola started working with the Latino community in 2005 in Charlotte, North Carolina, addressing the needs of domestic violence survivors. And since then, she has continued to work for nonprofit agencies in South Carolina, focusing on the needs of Latinos and others with limited English proficiency. She is now the Director of Programs and Training for PASO, where she trains CHWs for the community-based organization. Paola is also a member of the leadership team of the South Carolina CHW Association, and she will provide some reflections from that experience. Ashley Winterstrom is a co-founder of the Louisiana Community Health Outreach Network, LaShawn. She's a community health worker ally who has had the pleasure and honor of working with community health workers on various programs, policy development, and training efforts for nearly a decade. Ashley is committed to supporting community health worker leadership, self-determination, and professional development. She's currently chair of the American Public Health Association Community Health Worker Section Policy Committee, and she directs the Louisiana Community Health Worker Institute, which is based at Tulane University School of Medicine, and she will talk from her experiences with LaShawn and her broader experiences as well. Last but not least, the final panelist is Geoff Wilkinson. Geoff Wilkinson has worked closely with the Mass Association of Community Health Workers for over 13 years on policy, advocacy, workforce development, organizational development issues, and I'll have to add a ... for him as well. He became a CHW ally when he was executive director of the Massachusetts Public Health Association, the state's APHA affiliate, and then provided senior management support for CHWs at the Mass Department of Public Health for our state, where he worked for 7 years on our Public Health Commissioner staff, senior policy. He served as a founding chair of the Massachusetts Board of Certification of Community Health Workers and continues to support CHWs now as a clinical associate professor at Boston University School of Social Work, where he teaches community organizing and management, and he also didn't put this in there, but he is a community organizer from the old days. He also teaches health politics and policy for the Boston University School of Public Health. Next slide, please. Strategic planning is a disciplined effort that produces fundamental decisions and actions that shape and guide what an organization is, who it serves, what it does, and why it does what it does, with a focus on the future. Effective strategic planning articulates not only where an organization is going and the actions needed to make the progress, but also how it will know if it is successful, so metrics and measurements of success. Next slide, please. we're going to talk about the strategic planning process, and we kind of break it into three kinds of areas. One of them is development of the plan, and we're going to spend a lot of time there today, which is around assessing your current position, where you're at, discussing your mission and vision, where you want to be, really focusing on goals and objectives, what we want to accomplish, and then the strategies to achieve the goals and objectives. How will we get there? How will we measure it? There's also execution of the plan, which is basically the implementation process, which is usually based on action items and accountabilities, who's responsible parties, timelines, when, et cetera. And then the all-important piece, which is the impact, which is the ongoing refinement and evaluation of the performance and how you're achieving your measures. Next slide, please. This is an excellent graphic to kind of put into buckets the three cycles or parts of strategic planning: the development, execution, and impact. You can read the slide for yourself with some of the bulleted items. We, for the sake of this call, are going to be focused on the first column related to the origin of the strategic plan, roles and resources for the strategic planning process, and elements of the strategic plan. Future webinars may address things like, under the execution of the strategic plan, things like how you communicate the plan, how you prioritize strategies, and how you translate strategies into actions. And then finally, there may be another call focusing on the impact around describing your success, defining measures of success, and how you track and summarize progress, and, as a way to also revise the plan as needed. So those will be for future, but today we'll focus on the first column. Next slide, please. Now we will transition directly into the panel discussion process, where I will field or ask one question at a time. Each panelist will get an opportunity to answer that, and then we'll do a short question and answer before going on to the next question. Next slide, please. This, once again, is a highlight question one, which focuses in on the origin of the strategic plan. Next slide, please. The first question to the panelists is two-part, and it's related to the origin of the strategic plan. Number one is, why did you do a strategic plan, and what were the anticipated benefits of doing one? How did you decide to develop it, and who made that decision? These are the four key elements we're asking panelists to reply to. I'd like to ask the first panelists, Ashley and Dana, to reply to this question.
Thanks, Durrell. Sure, so we'll go ahead and get started. I think it's useful to just give you a little bit of a quick background on how the Louisiana Community Health Outreach Network came to be, because that really influenced our decision to create a strategic plan. So one of the sort of key things that happened in developing Louisiana Community Health Worker Outreach Network, or as we lovingly call it, LaShawn, we had keep in mind this is mostly based in New Orleans, so it started kind of in the post-Katrina context. We were working on a project to help build local capacity to deliver mental health services in the post-Katrina context. And one component of that was that we had an outreach element. So we had several people who were trained under that project to do outreach around mental health. And in order to make sure that folks felt comfortable with their job, we had monthly meetings where we would bring community health workers and outreach workers together to kind of talk about how things were going. And that project went from 2008 to 2010. When that project ended, we had developed a pretty nice group of community health workers that, again, came together once a month to just sort of provide peer support for one another. And we realized that in spite of the fact that we didn't have any funding to continue the work anymore, there was still a lot of value in people getting together to sort of share resources and talk about, the various issues that were going on in our community. So we asked folks, hey, are you still interested in continuing to get together? And by and large, people said yes. And then we also asked, should we be expanding this beyond just folks who are working in mental health? And everyone said, yeah, absolutely. There's no reason that we shouldn't bring more CHWs together. So we did some strategic outreach as well as a survey of local community health workers, and then did a community health conference where we presented those results and kind of invited folks to participate in LaShawn. So just know that it sort of started as a very grassroots effort, but we invited anyone and everyone working in the community health outreach field to join us. And so as we continued by having our monthly meetings, we realized, well, gosh, as long as we've got all these people coming together, we probably need some kind of plan to figure out what it is exactly that we're trying to do here. You know, we've got community health workers, but so what? And so we decided to create a strategic plan, and the basic thing, again, we wanted to do was really just define our mission and our vision. And then as far as, you know, how we decided to do it, it was, you know, the founding members talked a lot, and we all had kind of different ideas about where we might potentially go. We realized that, you know, in order to sort of create a cohesive idea about where we went and to keep people involved, we were going to have a strategic plan, and so that was kind of the origins of how we decided that we were going to do something a little bit more structured and figure out exactly where it was that we wanted to go. And certainly an important piece of that was not only defining where we wanted to go, but making sure that we had a clear sort of vision about who we were, who was a community health worker and who wasn't, and this is, you know, something that we still struggle with in the field today, but also we knew that having a strategic plan would help us define who sort of fit into our network and maybe who didn't, who was an ally, and then we also knew that would really help us with education, because we knew that there were a lot of people working in the community health field who were sort of vaguely aware of community health workers but didn't really understand all the great work that CHWs did. So we knew that a strategic plan would be really helpful in moving forward our outreach and education, not only within the CHW field itself, but also folks who are working in related professions.
Thank you very much. Next, before Jeff answers this, I really want him to expound. We actually asked him to be part of this call to provide some background, as he's been a person who has actually facilitated strategic planning. So, Jeff, before you answer question one, I just ask you to expound on some of those thoughts, basic thoughts about strategic planning I mentioned earlier. Thank you, Jeff.
Thank you. Good afternoon, everybody. I'm going to be adding some general remarks about strategic planning based on a number of years of work with various organizations, and ranging from a church to state government, but including a number of community-based and statewide nonprofits. And I'll just say, to add to the definition of strategic planning that Durrell shared earlier, strategic planning is, when we say it's a disciplined effort, it's important to recognize it's not a glorified to-do list. It's a fundamental set of decisions. So we were talking about the foundation, the base, the heart of what's important about your organization. And that requires defining priorities. It was taking care and thinking about who's going to be involved in the planning process. And it provides the basis for specific action, determining who's going to do what, when they're going to do it, in order to achieve their results that is set in the planning process. When we're developing strategic plans, we are starting with research. And it's really important to consider the environment in which the organization is working, as well as the organization itself. That's typically called an environmental scan. It requires looking at the economic trends affecting the organization and its constituents, looking at political factors such as whether state legislators, governor, et cetera, are favorably inclined to your mission and programs. What other organizations with similar missions are doing or not doing about what you care about, if there are any organizations. In business, they'd call that the competitive environment. But there tend to be public health advocacy groups and others that may be working on CHW-related issues. So we need to know what they're doing and what they're not doing. We need to look at public policies and institutional practices that are affecting CHWs, and what other key actors are doing and interested in. For CHWs, those other key actors might involve health providers, health insurance payers, public health providers, et cetera. Even media coverage about CHW issues and how the media is addressing CHWs. Internally, a strategic plan looks at the organization's programs and policies, its resources, and its capacity. So resources certainly include funding, but they also space or communication capacity. Who are our partners? What staff do we have, if any? What board members do we have? Capacities mean what the organization can do well, what the staff and members know, what are the skills that they have, what can they do, who do they know who can help the organization. What partnerships and allies are really important to us. And it's also important to look at the organizational culture. In other words, the unwritten norms of behavior, communication styles, underlying expectations that influence how things work and why. It's important to be straight with ourselves in doing this research. There's no point in sugarcoating problems that may exist. And so strategic plans typically include what's called a gap analysis, which is what it sounds like, just identifying the gaps so that we can look at what's not working as well as what is, and that's helpful in thinking about moving forward. So as we look at the first question, why do a strategic plan? What are the anticipated benefits? This will obviously vary depending on organization and depending on where the organization is in its development over time. But for CHW associations, it typically includes expanding the active constituency, and that's active members, but also partners. Developing leadership capacity, and often we're working with voluntary board members or advisory board members or whatever we call them, and they're typically busy, and they may face constraints in how to participate in meetings. So what do we do about that practically? How do we develop those capacities that I was talking about, various resources and staffing abilities and membership skills and partnerships? A lot of times CHW associations are concerned about funding, and also they have specific policy and program goals. How do we make benefits and workforce conditions, compensation, better for CHWs? How do we expand use of CHWs in the health system? So those are all legitimate outcomes that we might expect. Who makes the decision to do a strategic plan will vary depending on the stage of organizational development. I just want to point out it's often the case that major changes may trigger planning. Inside the organization, that could be a change of leadership, a departure of staff, environmental, a new policy, a new law, a change in government, a change in funding opportunities. A lot of small organizations don't do strategic planning routinely. They do it because they feel, for whatever reason, at a certain point in time, that they're faced with some critical challenges and or opportunities, and then that'll trigger strategic planning. Other organizations have been through it, and they feel like it was useful, and they decide to do it again. Next slide. So I just, in thinking about how to develop a strategic plan, it's typically guided by the staff and board leaders, but sometimes funders will say, we want you to do this. And it usually takes time. It's not something that's a go, no-go decision that happens at one time. Somebody comes up with the idea, maybe we should do this. That requires some discussion with folks and some consensus. And people have to think about, well, when would we do it? Who should be part of it? What process should we use? And then you get into the details. So it would be unusual for a CHW association to decide in one quick conversation or by fiat, by one or two people, let's do this. It's not unusual to take some time figuring it out. And we'll go on to the next slide, I think, for the next panelist.
Yes, and I thank you so much, Jeff, and I ask folks to please remember to type your questions concisely and have those questions directly related to CHW strategic planning for associations and networks and the presenter's comments. Thank you. I'd like to ask Paola for the next response to question one.
Hello, everyone. So for number one, FASA started with one person that many of you know. I recognize a lot of names from the Unity Conference. It's good to see you again. That person was Julie Smithwick. She started addressing gaps between the Latino community and healthcare. And as time passed and many individuals or families were served, Julie was approached by healthcare providers, other health providers, and other local agencies and Latino community members. And that is when she realized it was time for growth. hence a needed strategic plan to create objectives which would address the needs of the healthcare providers, the community members, and pasos, and create direction for expansion and effectiveness. It was anticipated to review the strategic plan annually. And as I discuss portions of pasos, I will refer to a official and an unofficial strategic plan process. And the next question is, how do you decide to develop a strategic? Who made that decision? The need for the organized growth determined that need that a strategic plan was due, and Julie Smithwick made that decision. In 2005, those of you who don't know her, she was by herself in Richland County serving Latino families and individuals, and she had to take it upon herself to say, okay, something needs to happen. And she made that decision, and that was what we call the unofficial strategic plan, where she just got everyone together and said, okay, what are we going to do? And getting feedback from everyone. After a workshop was held, during the unofficial one, she met with emerging community leaders, the promotores as we call them, and together they produced the next step. This was the first unofficial strategic plan, which despite its natural production gave a great foundation until the first official strategic plan, as I mentioned, which was formed with the help of an advisory council. Next slide.
Okay, we now have entered our question and answer portion of the call. I have the first question, and please, folks, if you have other questions, please type them in as soon as you can. And the first question from Caitlin Allen is, how, if at all, do you build evaluation into your strategic planning process? And I think this is, how do you build it in the front end? How do you integrate it early on as you're developing your process? I'd like to ask Jeff to start with this response, and we may have time for one other panelist if there's no other questions entered.
I'll just give a very quick answer to say that you build evaluation into your strategic plan through setting specific measurable objectives. And we're actually going to talk about that a little bit ahead in this webinar. But if you know what it is you're trying to achieve, it's a lot easier to figure out the evaluation plan later. Okay.
And Ashley, can you talk from experience of someone who recently did this? Did you, or how did you build evaluation into your strategic planning process?
Sure. I would just echo Jeff's sentiments about the importance of always including evaluation in the planning stages. That's one thing I'm always teaching my poor public health students. I would say that we probably could have a job. We did set some goals as far as conducting outreach and membership engagement, things like that, so we had some objectives in that area. And again, we'll talk a little bit more about that later on, as Jeff mentioned. But I will say sort of a very, very grassroots, relatively new association that had never done strategic planning before, we definitely could have done a better job. So for those folks who are thinking about conducting a strategic plan, I absolutely encourage you to think very carefully about your evaluation plan and writing very specific objectives. And then just one little tip that is always helpful in writing objectives is to make sure that they are SMART, SMART being an acronym for specific, measurable, attainable, reasonable, and time-bound, which I'm sure many of you have already heard that acronym in other contexts before, but just one thing to kind of keep in mind as you're developing your evaluation plan and your strategic plan.
Thank you so much. I was waiting for anybody to interject the SMART objectives into the dialogue. I think we'll get to that later, but thank you both for your responses. We are making good on time, and with that, I will move forward to the next slide to start the next question. Now we're going to kind of delve into question 2, which really tries to hone in on the roles and resources for the strategic planning process. Excuse me. Next slide, please. The questions that we asked the panelists to respond to right now around roles and resources are the who facilitated the process, who was involved with the process. We want to ask if you can make comments about the commitment of time, the time commitment needed for those involved in planning, the time commitment needed for those to set aside time to be involved in the multi-hour and or multi-day. If you can add any items related to some of the external resources that were needed, space funding, et cetera, anything related to the facilitators and barriers to the process, what helped, what got in the way, and then finally, in your closing response to this question, we ask you, how did you engage CHWs from the very beginning through the process and keeping them engaged and involved? Thank you. And next slide, we'll go to the first response from Geoff Wilkinson.
Hello again. I'll just say that facilitation from outside the organization is the norm, but it's not necessarily required to do it that way. The value of having an outside facilitator is that you get outside eyes, and hopefully you get a set of skills in the strategic planning process as well as in group facilitation, so that your staff and members, board, leadership, whoever's involved, doesn't have to be thinking about the process aspect of it. They can focus in on the content and their ideas. But in a pinch, you can, if you've got some skills, do it from inside. Board members, advisory board members, leadership, sponsorship committee, whoever is giving guidance to the organization certainly has to be involved in the process. If the organization has staff, they typically are involved in the process, at least the director, but more usually all staff. In CHW associations that have staff, the staffs are small, so that typically it would involve them. And then, of course, members of the organization, partners and stakeholders, you have to figure out how to get their views. And sometimes I've seen them actually brought into the strategic planning committee and participate directly in all phases. It's probably more typical for organizations to involve them through surveys or interviews in person or by phone, often by the facilitator. And there are various technologies and techniques and methods for this. But the idea is to get information from outside the organization as well as from inside to guide planning. And that's all part of that research I talked about earlier. It takes resources and it takes time to do this. So no matter how you go about it, you're going to spend a fair amount of time in planning calls and meetings. It's often the case that an organization will have a planning committee that meets quite a bit, and then that leads often to a strategic planning retreat or multiple retreats, depending on the organization and the scale of planning, where people spend the best part of a day or a whole day or a couple of days really banging the plan together. The research is often requires resources. If you do survey or stakeholder interviews, especially if you pay a facilitator to do it or to help with it, the facilitator herself or himself may cost money. Typically that'll be the case, but sometimes you can get an ally to do it. You got to make sure to have some administrative support for record keeping, taking minutes, distributing materials around. You'll need some space. That's often available in kind, but don't skimp on food because that'll really help the process go much better. Next slide. What helps with planning is the commitment and passion, and we don't lack that in CHW associations. Making sure you've got the right participants. We can talk a little bit more about that. And then the availability of resources can be a great facilitator. If you get a funder, for instance, to say, we will put money on the table for you to do a strategic plan, that allows you to have more time, have professional facilitation, and certainly facilitates planning. Also, I think certain needs and opportunities in the planning environment, the policy environment, can spur good planning. But on the flip side, it takes time to do it. A lot of our members are busy, staff are busy. Sometimes we've got participants we'd like to be at the table, but they're overextended or even burned out. A lot of CHW associations don't have much money, to do this planning, so we have to kind of work on a shoestring or be very creative with in-kind resources. And just the limited capacity of the inertia of day-to-day, what can hold us back. I'll leave it to the other panelists to talk about how CHWs were specifically engaged, but I'll say that for our associations, that tends to be the heart of the strategic plan. That is always a challenge and a promise of this kind of strategic planning.
Thank you very much, Jeff. I'd like to ask, next slide, the next panelist, Paola, please respond to question 2. Paola?
Sorry, I didn't take my mute button off. The executive director facilitated both the strategic plans, but currently organizational leaders, we call this group the vision team, are involved in seeing the overall activities and direction of PLATOs. We also, when we do meet in our vision team, we do get feedback from the community health workers on all different levels. We currently have volunteers, we have specialist community health workers, and we have staff community health workers. So we have feedback from everyone, including the now advisory board the advisory council that we have. And now the people involved in the informal first strategic plan, it was composed of workshop participants, existing partners, and the executive director. An estimated, so the informal one was the workshop participants and a couple of existing partners and the executive director. But then with the formal strategic plan, and I hope that's not too confusing when I say jump around from informal to formal, but an estimated 12 members from different entities like the University of South Carolina, March of Dimes, Department of Health and Environmental Control, First Steps, Migrant Health, staff of PLATOs, and community leaders and community health workers were involved in the formal strategic plan. Now, the time commitment in the initial informal meeting participants, they just stayed maybe 30 minutes, maybe an hour after the workshop they allotted time for, and the executive director took advantage of the venue and the attendance to discuss the strategic plan. Jeff had mentioned earlier that food was important, and in our workshops we provide refreshments and just taking advantage that everyone's already there. There's already refreshments, already this great opportunity and environment where everyone's learning, and it just worked out really well. It's very organic. And the latter formal event was more difficult in planning because it involved numerous full-time professionals for more in-depth strategic planning, and they did a SWOT analysis. So it was more kind of what Jeff was saying, like more of a retreat style, more in-depth. And whenever you want to grab people from the agencies, like I mentioned earlier, Migrant Health, First Steps, DHEC, March of Dimes, they're spread out pretty thin, and to ask for their time, it's really difficult to get everyone. Everyone has some time here or there, but to get them all at the same day and the same time, that is the big challenge. The external resources that were not really, no, for us at least, no external resources made the process more difficult. By 2008, and remember it started in 2005, PLATOs was statewide and was housed at the University of South Carolina at the Arnold School of Public Health. And the facilitators and barriers to the process, prioritizing and meeting regularly to have a continuum of conversations to achieve outcomes were key to the process, and that was very helpful. The executive director continued to be a facilitator, but in both informal and formal strategic planning periods, all of the present participants had the ability to provide ideas and feedback. Last question, how did you engage CHWs? They were part of the advisory board council in the beginning, and it is also important to note that our CHWs are also staff. We look for opportunities to keep the whole organization informed and also receive feedback regarding deliverables. Many of our CHWs, both volunteer and staff, serve on boards and panels on a national level, and they're very active at a local level in the 6 sites that we have across South Carolina. And right now, we are in the process of putting together a Pasos Promotores, community health worker, advisory council so that they have 2 to 3 lead community health workers, promotores, in each of our sites, and they will be the voice of their group, and we will meet with them. At this point, I think it's going to be quarterly, and they can really help give a lot of shape to the strategic plan as we continue and to grow and be organized. Next slide.
Thank you, Paola. Now I'd like to ask Ashley and Dana to provide some feedback on question 2.
Hi, yes, thank you. Our board members were very vital in facilitating the process. We had some core members who had stayed through the duration even till now, especially Ashley and Ms. Catherine. So it was really good leadership that carried on that helped us facilitate our strategic plan. But we also had all of our LaShawn members that were involved. LaShawn, like as Ashley stated in the past, we are a grassroots organization, but we have a lot of commitment from people that really wants to see LaShawn move forward. So that was really, I think, an asset of having people that was committed, that have stayed from the beginning and still to this day. We had 2 meetings that was probably dedicated for maybe half a day meetings that we had that focused just on strategic planning. And I will agree, food is very helpful. It helps. The times that we could not provide it ourselves, we were in a building, in a facility where you could bring in your food. So that's always something that if you can always include that, for some big events, that helps a lot. Our space was donated by one of our partners, a nonprofit organization, so that was one of the resources. So whenever we needed to meet for whatever meeting, usually whatever time of the day, even afternoon, after work hours, we had the availability of our meeting space. So that was a huge, thing that an asset that we had. We had a simple plan during our monthly meetings. So usually we did not have a special time outside of our meeting times to meet. We meet once a month, and we wanted to take that time to just develop our strategic plan. Like I said, we had the 2 big meetings, but after that, our strategic plan development carried on throughout our monthly meetings. We had some barriers to the process. There was differences in opinions. Some of our community health workers wanted to focus on all communities and, everything. And, that's the heart of a CHW. We want to help everyone. But we wanted to, we had to think about it, and our focus needed to be on us as CHWs. So our meetings are, for peer support, or how we say, a place to vent. So there's a lot of confidentiality that happens in our meetings. But we needed to just have our focus directly on us as CHWs and those that support them. And how did we engage? We did most of our planning, like I said in the past, during regular meetings. So having that time that we know, everybody knows every month these meetings are going to occur at this place, it kind of gives us some streamline and some ground understanding that this is a commitment that we have made. So every month, everybody comes to the table, and I think we're going to start having another strategic planning meeting just to kind of recap where we are now, since it's been a while since we had our initial one. But, yeah, that's it.
Thank you very much. As we enter the next question and answer phase, I ask people to please type your questions in. I first want to ask Gail, do we have a first question?
So this is Gail. I'm not sure. There are a couple of questions on the left-hand side, and I think that they. There's now a third one. Okay. So I'm going to try to sort of like synthesize and figure out what makes the most sense at this point. I think the first question is about engaging membership. I think the second question is about who was involved in the South Carolina Advisory Council, and I'm translating that to mean the strategic planning group, and then and maybe we'll get to the third question after that. But I guess maybe it would be important to focus on, and I think all of you have alluded to it, but exactly who was part of that planning process, and how big was the group? What is a reasonable size for a strategic planning session?
So for the first question about who was engaged, how large, I'd love to ask Dana and Ashley to take that question.
Sure, this is Ashley. I would say probably about 20 people were involved, and as far as I can recall, everyone that was involved, other than myself, was a CHW of some sort.
All right, thank you. That was so brief, I didn't get a chance to catch up with you. Okay, but thank you, Ashley. The next question I'm going to pose to Paola, and that is, what is the composition of your advisory council? You just mentioned the advisory council being developed. Can you tell us some more details, who they are, maybe how that process occurred related to how they would impact your strategic planning process?
Yes, and as I mentioned before, the initial advisory was from the University of South Carolina Arnold School of Public Health, March of Dimes, DHEC, First Steps, Migrant Health, and community leaders, and they were church leaders, religious leaders, and community health workers that we had already at FASOS. And right now, because things are shifting and we are organizing things a little bit better, and a lot of people that were in the initial advisory council, they're no longer with us. And what we are looking for and who we have right now is one person from media, one person from healthcare, one person from financial, one person from legal, so that we have, and there's more, so we have a broad spectrum of people who could really give us great advice when we're formulating strategic plans each year. And I hope that answers the question. It's specifically who they are, and there's other nonprofits that are part of our advisory council right now too. But it's just the key for us is to have it for it to be diverse, so that when we have questions about financial planning or visibility for us in communications, that we have the right people in place who can give us the most appropriate information.
Thank you very much, Paola. And we're going to move to the next question. Next slide, sorry. Thank you. So for the next question I'll pose to the panelists, we're going to focus on the elements of a strategic plan. Next slide, please. And those elements that we're asking each panelist to comment on are related to the mission and vision, the goal and objective, the strategies to achieve these objectives, your time horizon, and some of the metrics or measures that you used related to measurements of success. We ask you to work these comments in for this question, and Paola, you will be up again as the first panelist. Thank you.
Sure. And as you can see, I have posted the mission and vision, and it's funny, this morning on NPR I was listening to someone talk about, they were talking about an important company in Charleston, and they asked him, how do you do it? How has this company survived since the late 1800s? And he said, it's just following our mission and our vision. It's simple. If you follow what you believe in, then it's going to work out, and everything's going to fall into place. I think we all know that it can get a little bit more complicated than that, but it's definitely something to hang on to, and that was our first step. The first step when we got together for the strategic plan was to formulate the mission and vision that you can see, and you can you're seeing it right now. So we can go to the next slide. And this is a sample of what our goals and objectives look like. This is specifically for our Newberry, Saluda, Edgefield area. And this is one of the most rural areas that we have for PASOS. And it has a focus on interconception health. And so we have this goal, and someone was asking about measurements and what it looks like. So this is an example of ours. We want Latinos in South Carolina to be connected with reproductive, maternal, and child health resources they need, and will have the necessary skills. So that's what we want. So how are we going to do it? And so then we have these 4 different objectives that is a great guide for the community health, the staff community health worker, and his or her, or in this case, her group of community health workers that are volunteers and members of Newberry, Saluda, and Edgefield. So each year they're looking at least 75 Latinos in the counties will be assisted with navigation of maternal child and will have necessary skills. And then, for instance, objective 2, at least 50 Latinos in these counties will connect to the needed services after resource navigation. And then, as you can see, it's pretty easy to follow. And at the end of the year, or as the year progresses, we meet with our community health workers, the staff, and it's a supervision meeting. How is it going? Do you need some help? What do your numbers look like? And the system that we use for, you can go to the next slide because I think it's going to go into what I'm saying. So we have the addendums that you see. So there's an overall strategic plan, but each site has an addendum, and it has the specific goals for each site. The timeline horizon, it's updated yearly, or if there's a project that comes up, if we have a funder who comes along who's very interested in promoting or adding to one of our programs, let's say oral health. We have oral health is one of our programs, and if they say, okay, we want to see this program grow, here's X amount of money, but we want to see this. So that will change a little bit our strategic plan in the addendum for, let's say, the Midlands area. And the metrics and measures that are used, we have a web-based data collection. There are diverse search options which capture qualitative and quantitative data. We provide monthly or annual reports to several grantors. The graphics and features provide great accuracy and real-time data with anti-duplication prompts. And that's it for me.
Thank you so much. I'd like to now ask Dana and Ashley to respond to this question about elements of your strategic plan.
All right, great. So the vision that we came up with is pretty broad. Just community health workers will be respected and acknowledged as frontline public health professionals. And we basically came up with that because we felt like one of the largest challenges that our CHWs were having was that people just didn't know who they were and that they weren't properly respected, or the work that they were doing wasn't really well respected. So our mission specifically is to support community health workers while advocating for improvements in community health. We do this by convening community health workers to share resources and offer peer support. We also offer professional development opportunities, and then we also aim to increase recognition for the CHW profession locally, nationally, and internationally. So again, you can kind of see a bit that some of this reflects a bit of the attention that Dana was talking about earlier as far as when we were creating our strategic plan. We were sort of trying to wrestle with the issue that we knew the CHWs that we work with, of course, are out in the field every day doing incredible work to advance the health of communities. So the thinking that they tended to bring to the table was, gee, we've got to be advocating for our communities, we've got to be helping them, but then we also had to say, well, wait, that's great that we do that in our professional jobs every day, but we also need to make sure that we're advocating for this particular workforce. So I just mentioned that to say it's been kind of an interesting struggle that we've wrestled with a bit, just to try to help CHWs take a step back from the work that they do every day and help them understand that in this case we're really working on advancing the profession as a whole, not just community health. But anyway, that's kind of why we have that piece in our the first line of our mission about we're also advocating for improvements in community health. Next slide, please. As far as our goals and objectives, we won't go through those in great detail, but just sort of overall our major goals and objectives were to strengthen and grow our membership. As I mentioned earlier in response to the question, we have probably about 20 people involved in our strategic planning process, and one of the main things that we wanted to do was really do a lot of outreach to other CHWs, and particularly CHWs around the state, because the majority of the folks who participated in our strategic planning process were from the New Orleans area, and of course we know we've got CHWs working in Baton Rouge and many other areas of the state, so we've been doing our best to try to do some outreach to that.
For the strategies to achieve our objectives, we do a lot of outreach, community health workers, that's our thing anyway, but we try to come together on some of the outreach events around the city. We have an annual conference, and actually we just completed our third conference in June. And each year it grows and grows, so that's something that we really are happy to see happen. We do have dues. It's a small monetary money that we ask for. It's $5 a day. $5 a month, or $60 for the year, and it just helps us to support things that we're doing within LaShawn. Maybe if there's a training that one of the CHWs would like to go attend but can't afford it, maybe we could take some of those funds and use for that. We have a very listserv that we send out a lot of our members and other organization information, and we've been told on many occasions that a lot of people find outreach opportunities and ways to connect through that. And we also have professional development seminars. So we want to make sure that the CHWs are getting the core values of and things like such as we've done cultural competency. We have availability that with my work with LSU, they have the bridge to our webinars and seminars on cervical screenings, on colorectal screenings, tobacco cessation. So we just want to have a well-rounded CHW. We are in the process of our timeline, so we're still working that out. But that is something that we continue to work on. And our metrics is our membership. We just want to increase our membership, and like Ashley says, based on our central base being here in New Orleans, we have had some interest from outside areas. So we want to really expand our membership to be statewide and become the state forerunner in CHW work.
Thank you so much, Dana and Ashley. I now ask Jeff to respond to this final question to the panelists. And please type your questions in. I've seen more coming in, but please continue that. Thank you. Jeff?
Thank you. So I'm going to extrapolate some general principles and guidance from the specifics that you've just heard. Overall, a strategic plan usually starts with a vision statement, which is kind of a dream state, an imagined future state. So you just heard it with LaShawn. CHWs will be respected and acknowledged. This is the world as we want it, and it has consideration of how the organization fits into that world. But it's broad and it's visionary. The mission statement says what the organization is for, what it's trying to achieve broadly, what it's about in the world, why it exists. And it refers typically to the core values of the organization. So these are useful tools. Without direction, it's hard to make choices about how to use the organization's resources. And without vision, it's hard to set direction. So we want to start out with thinking about what's the world supposed to be and how does our organization advance that. It takes a surprising amount of time to craft a good, so don't get so carried away with that process that you don't have time in your strategic planning to get into the nuts and bolts of objectives and strategies. But you have to take the time to figure out what is this really about. Goals and objectives are really kind of honing in more specifically. What does the organization want to accomplish in the planning time frame? So back to LaShawn, to support CHWs and advocate for improvements in community health. Good example. The objectives, Ashley mentioned earlier this idea of SMART objectives. Those are hard to craft sometimes, to be specific, to have it measurable, achievable, relevant, time-bound. But the more specific you can be, the more SMART your objective, the more likely that you'll have a basis for measuring whether you're being successful. And I just want to point out that objectives can be generally about what you want to result, what the outcome is, what are the kind of the task activities that you're doing, or the process. What are the relationships? What are the activities? And there's a whole literature, as you can imagine, and a lot of methods about that. Next slide. Next slide, please. Thank you. Strategies are how the organization is going to achieve its objectives. And so you need to think about what's holding us back, what's moving us forward on that. What tools do we need in order to achieve our objectives? It's important to distinguish strategies from tactics. Tactics are the activities that the organization does. Paola mentioned earlier a SWOT analysis. That's an acronym. It stands for strengths, weaknesses, opportunities, and threats. So in light of those strengths, weaknesses, opportunities, and threats, you want to be thinking about the hows, the direction. If you think about your overall strategic plan as a roadmap, the goal, if you're in Chicago and the goal is to get to New Orleans, then that's your goal. Now you can have different ways to get to New Orleans, and so you may say as an objective, well, we want to be in New Orleans with X number of people by X date. Your strategy is going to be, how are we getting to New Orleans? Are we going to fly? Are we taking the train? Are we driving down there? Are we going to go by bicycle? But that's, once you make a decision, let's say we're going to fly from Chicago to New Orleans, then the tactics are, okay, which airline, which flight, what luggage am I taking, etc. So don't jump to which suitcase to pack before you figure out how you're getting there. It's not easy to set strategies, but if you don't figure out what's not working for your organization as well as what might work, it's hard to figure out how to direct your resources. And that's really what a strategy is, a basic choice for how to use resources to achieve your aims. We have to choose our directions, or in the words of an old proverb, we're likely to end up where we're headed. Strategic plans often are crafted for 3 to 5 year time frames. You just heard LaShawn is a 1 year. I know another CHW association, state-based association, that's doing a 1 year plan because the events that have recently triggered their decision to do a strategic plan have them anticipating that a year from now they are likely to be in enough of a different place so that they'll want to redo their strategic plan. It also doesn't make sense to do strategic plans for too far ahead because the world is changing so fast. It's hard to figure out in advance what's going to happen. And that can even be as simple as funding, but it's also true in terms of the policy environment. When CMS came up with this new ruling for a lot of state associations, it presented some strategic challenges. I was involved with an organization that decided that it wanted to stop being a service-based group and wanted to be an advocacy-based group. I was involved with an association that decided its strategy was to no longer depend on other organizations to do its advocacy. CHW is bound together and said, We need our own association. The overall goals were the same, but the strategy had to change. So again, your metrics or the measures depend on the objectives that you set. What are those SMART objectives? And then evaluation's relatively simple. It still takes time. It still takes care. You have to gather the information you need to measure what you wanted to figure out. But if you don't know where you're headed, you're bound to get there. That's supposed to be a joke. Okay, that's it from me on that question. Thank you.
I want to thank you so much. We are now at the last question and answer portion. We have made good time during this call. I thank all of you for your comments. And so now I want to check in with Gail and see if we have a first question for the group.
So this was a question that came a while ago, but I think it's, I think, as I understand it, it's about decision making. And it's about how decision making gets done in the context of strategic planning. And it also, in a way, ties to one of the other questions. How do you balance the priorities of a funder versus the needs of the workforce? So maybe you can direct that question to a couple of people, Durrell, around how that. Is this a consensus process? Is this a vote process? What's the process for making these decisions in the context of strategic planning? And what role, I guess, does the outside influences have versus the needs of the community health workers that are engaging in it?
Got it. So I think I first posed a question to ask you the last time. So I want to ask this of Viola. So this sounds like a kind of a two-part piece, but if you can comment on both or either, it would be great. And that is around some of the comments earlier. Panelists talked somewhat about the processes, but can you kind of delve into the decision-making process and kind of the how and the who a little bit more? And also, while you were making those decisions, it sounds like people want to hear how did if there were funders involved, how did some of their maybe stated priorities get vetted or addressed versus the priorities maybe of the CHWs and the other members? And she may be on. And others might want to start thinking this might be one for two panelists, so I don't know if the team, Dana and Ashley, can also be on cue. But Viola, are you able to get off mute?
Yeah, I can answer Carol's question. I saw it earlier, and I know I mentioned something about funders and how that sometimes shapes the strategic plan. And I believe the direction of the question is or do the community health workers have a say-so in the funder, these decisions? And I hope that's what I'm understanding. And to give you an example, not too long ago, there was some potential money that could come our way, but it wasn't exactly what our community health workers were doing. For instance, in Charleston, and I asked the program coordinator there, said, "Hey, we have this opportunity. Would you like to explore that?" Ask the community health worker, ask the promotores, and she asked them, and they said, "We have a lot on our plate right now," and that's the measure we go by. We see what makes sense, because one of our big specialties is prenatal care. We have other programs through Early Childhood Initiative also. And so if there's some program or funding that falls into place with those programs, we give that priority, and it makes sense and it works. But if it's something that doesn't really make sense and it's going to be more work for our community health workers that are already doing a lot of work, then we just take a pass on it. So it's measuring and balancing if it's going to work or not. But definitely, yes, we get feedback from all of the community health workers.
Thank you. And I'll just say again, Ashley, I don't know if you have any comments on this, or Dana, but is there sometimes a tension or consideration if there are funders of the network that come into consideration while you're doing strategic planning, or that impacts your strategic planning process?
Oh, that's an interesting question for us because we have no money.
None.
Absolutely none. As we've alluded to a few times before, we are an absolutely grassroots organization. It's just CHWs who've decided to come together. So, no, I mean, really the only funds that we have ever gotten from an outside source so far have been just a minimal amount of support from Tulane and my institution for things like funding, food for meetings and things like that, and there hasn't been any particular agenda on that front. And then we've had a little bit of funding from one local health insurance company for our conference just this year, so that was long after our strategic plan had been developed. So so I guess in that regard we can look at the positive and say we haven't been affected by funds from outside areas. Obviously there's a lot of negatives with that too. And then to the other question about what was the decision-making process, it was all just consensus decision-making.
Yeah.
Awesome. Thank you so much.
Durrell?
Yes.
Can I just add a word about this?
Jeff, yes.
There are, since our CHW associations around the country vary in size and how long they've been working and what relationships they have, I think it's important for some associations to think about strategic planning as a valuable opportunity to attract money. Funders will and do offer funds specifically for strategic planning processes. This ranges from Blue Cross Blue Shield Foundation, other health payer foundations, to community foundations, and to progressive consortiums of different philanthropies, which are organized in different states and cities differently. But a lot of times funders will give money in various amounts to support strategic planning, and then that provides a framework for the organization to seek operational funding to actually implement the plans. So I wouldn't overlook this as a possibility, especially if your CHW association has been around a little bit, or if you've got a high-powered sponsoring committee or planning group with some connections. It can be a very good strategy.
Thank you very much, Jeff. We may have time for one more, Gail. Was there a pressing question that you noted from the chat that we can ask one panelist?
Yeah, so this is a question that's sort of a Gail and Tatiana blend here, and an Ashley blend of a question. Tatiana asked how are supervisors engaged in strategic planning, and then Ashley said that it's a grassroots organization, it's all volunteer. I guess my question is how have the association ensured that community health workers can participate in strategic planning? That is, if they need the support of their supervisor to be freed up for the day to do the strategic planning. Does anybody have any experience in dealing with that?
Okay, we have a couple of minutes, so that would be a question directly for the network. So if Ashley and or Dana want to make a couple of comments, or Paola, if you want to make a couple of comments, and then we'll go to the closing.
Sure. And again, when we were talking earlier about setting time aside for strategic planning, we make it as flexible as possible, so it could be during work hours or it could be after hours. And if it is during work hours, it's just part of work, and we incorporate that time so that we can to make sure that we get feedback from the staff, community health workers, or the volunteer ones. And a lot of times, the tricky part is the volunteer community health workers, because they work and they have families, and they might have a couple limitations like limited transportation. So we make it happen because we highly value the community health worker input.
So for those employed, have you had any situation where you worked with either funders or employers, kind of in our state we had this thing called Let My People Go letter that came from our health department, who was supporting funding for CHWs to help free up time during the day. Has that ever happened in your situation? And then we'll go on to Ashley.
I'm sorry, I don't understand. Like free up, so if they're working and they have plans, we make sure that they have time to be part of it? Is that what you're asking?
Yeah, like if I'm on the clock 9 to 5 and you do your meeting in the middle of the day, I still might need to get buy-in from my supervisor to attend your meeting versus to attend to clients. So I don't know if,
Yeah, so we know how important it is for everyone to participate, and we'll talk to anyone possible to make sure that they understand the importance of that community health worker's presence.
Got it. Thank you. So, and Ashley, any comment on this question about supervisor engagement, buy-in to the process, or, that's enough.
Sure. So just one point I wanted to clarify. I've been referring to our organization as very grassroots, and when I say that, what I mean is that we don't have funding, and it's just been very much community health worker led. But one of the comments that Gail made me want to clarify that the vast majority of our participants are paid community health workers. As far as supervisor buy-in, we did most of our strategic planning during our monthly meetings, which happen over the lunch hour roughly. Our meetings usually go from 11 to 12:30. So that's usually a time when people can take off and just kind of take a long lunch or sort of come in and out as they are able. So we haven't had a huge issue with supervisor buy-in. Dana, do you want to add anything?
No, and I think that was a key that I was going to make too, that it's doing lunch hour time, so that has that flexibility. But no, I can't think of a time that we had that issue that someone had some complaints about taking off.
In an ideal world, we probably would have done, whole day strategic planning process, and in that case, we probably would have, had to address that to some degree, but because we were able to sort of squeeze it in over the course of a few meetings during lunch hour, it wasn't a huge issue for us.
Thank you for that. We will not be able to get to any more questions on this call, but we are committed to getting replies via email post this call with input from the panelists. I'd like to go to the next slide. Really, I just want to thank everybody, and we're going to talk about a few things before we end. But before we get that started, I really want to invite Sergio to make some comments to open our closing. Sergio?
Oh, thank you, Durrell. I told the panelists, this was an extraordinary webinar and clearly demonstrates the depth and breadth of this issue. I did want to make one big comment, and this was mentioned by a couple of the panelists, and that is the fact that most people, and CHWs in particular, do not organize for the purpose of developing a strategic plan. I find in my experience that people who organize to do a mission statement or a vision statement or a strategic plan, in general, fail. I find experientially that, in general, people need to have a bigger purpose for organizing than just the issue of creating a strategic plan. However, having said that, it has been very clearly stated by the panelists that a strategic plan is vitally important to progression, maturity, and survival. And so, although I would caution fledgling organizations to organize solely for the purpose of developing a strategic plan, I would also share my own personal experience that a strategic plan is vitally important to your development and growth and survival. And this was expressed by I think all of the panelists. Actually, I would also like to say that it is evident, and I want to be explicit about it, that strategic planning is not a trivial effort. It is a significant effort. It requires significant devotion and commitment. It is a difficult process, and it is one that, although I admire PASO's strategic strategy of doing it every year, it is not something that I would be personally able to do every year. It is way too exhausting to me to do that. But certainly it is important to establish a strategic plan and a mission, and to stick to that, and to reevaluate it periodically, and develop strategies. I will say one last thing, and that is that we are experiencing a period of incredible explosion in interest in our field. And every opportunity, of course, comes with a cost, and so while we are experiencing opportunity, we're also experiencing the possibility of co-option and redescription of our practice. And so this is particularly an important time to really be able to develop a purpose and a vision. Our vision here in New York is to advance the CHW practice while maintaining the integrity of our workforce. It drives us, it directs us, it puts boundaries on our work, it puts boundaries on what we do and what we accept. It has been extraordinarily useful to us, and I hear from the participants that it has been useful to them too. So I just want to say this is not easy. It is necessary. It might not be the very first thing that you want to embrace, but it is certainly something that sooner or later you're going to have to deal with. I think we delved a little bit into the operational issues, and I am hoping that we will be able to have a subsequent webinar where we can address some of the operational issues. But I thank you all, especially Durrell, for all of your participation and your contributions to this webinar. Thank you.
Thank you, Sergio. I think he said enough comments. When Jeff was saying a quote earlier, I kept thinking of the quote, if you fail to plan, you plan to fail. And so that might summarize some of the comments Sergio made, but I really appreciate and value the other ones about the critical nature of self-determination and understanding your path and where you're going, as to not get pulled in one direction or another as winds change, et cetera. So I thank you for those comments. I want to move to the final slide, and I want to thank everyone. All of you who tuned in today, it's critical that we continue to spread the word. In that vein, everyone will be receiving via email the slides. Everyone who registered will also be receiving some additional questions. Because of the interest and nature in this topic, there will be at least 2 more webinars on this topic to kind of go into those next columns around the development and evaluation pieces, implementation and evaluation pieces of strategic planning. So once again, I thank everyone, and you all will get a post-webinar questionnaire. We really value and want your feedback. The topics have been determined by that feedback, so I urge all of you, if you have an area of specific interest beyond the next strategic planning calls, please send that. If there's anything specific to the next strategic planning calls, please send that or, input that into the webinar questionnaire. Without further ado, I'd like to adjourn the call. All those in favor? All those opposed? The ayes have it. I thank everyone for your time today. I thank all the panelists, all the participants, and the host for bringing us together. Thank you very much.
This concludes today's conference call. You may now disconnect. Presenters, please stand by.